One critical role of the nurse navigator is to really build relationships with patients. There is research out there that talks about the fact that in healthcare today, there are many caregivers involved in the care of our patients, and it's difficult for patients to connect with one person that they get to know and that they form a trusting relationship with. Nurse navigators partner with patients over time, and they build a trusting relationship, and so patients start to tell you the truth. They say which medications they really aren't taking, even though they told the doctor that they did. They admit the foods that they're eating so that we can help to convince them. Because without hearing what's really happening, that's not going to help us help the patient. So that relationship building is a critical piece. Another important part of being a nurse navigator is to really talk with the patients, meet them where they are without judgment, and find out what their hopes and their goals are for the future. Often patients with chronic disease have had the disease for years, and at some point in time, they end up no longer responding to traditional medication and treatment. And sometimes they prefer to stop getting treatment and consider palliative care or hospice care. And part of the job of the nurse navigator is to explore what is the patient needing and wanting right now, and how can we be part of the conversation that happens with their doctors that helps them to follow the path that they choose and to meet with their families and have those conversations. That presence and that connection with a nurse navigator really opens up much more of helping patients to make informed decisions and to really meet their needs and set reasonable goals for their future.